Hello guys, welcome to my YouTube channel Ambitious Dr. Ashwini, and today we will see the next protozoa, that is Trypanosoma brucei. So Trypanosoma brucei comes under flagellates. The one having flagellas comes under flagellates. So in this we will see the contents like describe the Trypanosoma brucei, describe the life cycle of Trypanosoma brucei, describe the pathogenicity of Trypanosoma brucei, describe the clinical features of trypanosomiasis, and describe the laboratory diagnosis of trypanosomiasis. So firstly we will start by introduction. The geographical distribution found mainly in the western and central regions of Africa, habitat and spread in the body. The parasite lives in the connective tissues, that is, the tissues that support and connect different parts of the body. From there, it spreads through lymphatic vessels to the regional lymph nodes. Later, it enters the bloodstream and may reach the central nervous system, that is CNS, affecting the brain and spinal cord. In short, Trypanosoma brucei found in West and Central Africa. It lives in connective tissues and spread via lymph and blood and can reach the brain and spinal cord. Now we will see the morphology of Trypanosoma brucei. It occurs in trypomastigote form inside the vertebrate host like humans. The shape is spindle shaped and elongated with a pointed front, which is anterior part, and a rounded or blunt back, which is the posterior part. Nucleus is found in the center of the body. Kinetoplast, a small dark staining structure located at the posterior end. It helps in energy production and movement. Flagellum begins near the kinetoplast, curves around the body, forming an undulating membrane, which is wave-like structure, and then extends out freely beyond the front end. Then pleomorphism. The parasite shows variation in shape and size at different stages. It is 10 to 20 micrometer long and about 3 micrometer wide. Antigenic variation. The parasite can change its surface antigens to escape the immune system, helping it survive longer in the host. In short, Trypanosoma brucei is an elongated, spindle-shaped trypanomastigote with a central nucleus, posterior kinetoplast, and wavy membrane with a flagellum. It shows variable shapes and antigenic changes. This is the structure of Trypanosoma brucei. This is the kinetoplast, a dark staining point. Then from here, the undulating membrane started, the flagellum. Here is the free flagellum. Then this is the cytoplasm, the nucleus at the center of the body. These are the pellicel, then parabasal body. Now we will see the life cycle of Trypanosoma brucei. There are two types of hosts: definitive host, humans, domestic animals, and wild animals. The parasite completes its main sexual phase here. Intermediate host, the tsetse fly, Glossina species, for example, Glossina pulpalis, transmits the parasite from one host to another. When an infected tsetse fly bites a person, it injects the infective metacyclic form of Trypanosoma brucei into the skin. The parasite multiplies at the bite site, forming a small sore or swelling. Then it enters the bloodstream, spreading throughout the body and causing infection. When another tsetse fly bites the infected person, it ingests trypomastigote forms of the parasite with the blood. Inside the fly's gut, Trypanosoma brucei multiplies by binary fission and it transforms into an infective stage. Then Trypanosoma brucei enters the salivary gland and multiplies, ready to infect another host. In short, humans and animals are the definitive host. Tsetse fly is the intermediate host. Infection spread when a fly bites, injecting infective forms which later return to the fly during its next blood meal. So this is the diagram of life cycle of Trypanosoma brucei. You can see tsetse fly takes a blood meal and injects Trypanosoma brucei into the bloodstream of human. Here, brucei multiplies by binary fission into the blood, lymph, and spinal fluid. From here, tsetse fly takes the blood meal and ingests Trypanosoma brucei. Then, in the midgut of the fly, Trypanosoma brucei multiplies by binary fission. Then, Trypanosoma brucei transforms into an infectious stage, and Trypanosoma brucei enters the salivary gland and multiplies, and again it infects the human. In this way, life cycle goes on. Now we will see the pathogenicity of Trypanosoma brucei. Entry into the body. Infection spreads when a tsetse fly bites and inject the infective metacyclic trypomastigote into the skin. Local reaction. At the bite site, a painful sore, that is trypanosomal chancre, develops due to the local multiplication of parasites and inflammation. Spread through blood and lymph. The parasites enter the bloodstream and lymphatic system, spreading throughout the body. These causes fever, headache, and swelling of lymph nodes, especially at the back of the neck, which is called as Winterbottom's sign. Central nervous system invasion. After some time, parasites cross the blood brain barrier and infect the brain and spinal cord. This leads to meningoencephalitis, which is inflammation of brain and its coverings, results in disturbed sleep cycle, confusion, and extreme tiredness. The stage is also known as sleeping sickness. Antigenic variation. The parasite keeps changing its surface antigens, helping it evade the immune system, which causes chronic infection and relapsing fever. If untreated, gradual neurological damage, coma, and death may occur. In short, Trypanosoma brucei causes disease by multiplying in blood and lymph, invading the brain, and evading immunity, leading to fever, lymph node swelling, and sleeping sickness, which can be fatal if untreated. Now we will see the clinical features of trypanosomiasis. Clinical features of Trypanosoma brucei infection, which is sleeping sickness. First one is trypanosomal chancre. A painful swelling or sore appears at the site of the tsetse fly bite. This is the first sign of infection. Then, lymph node and brain involvement. The lymph nodes enlarge, especially around the neck. The parasite later spreads to the central nervous system. The early symptoms are fever, headache, tiredness and weakness, loss of sleep at night, which is disturbed sleep pattern. The late stage meningoencephalitis, which is inflammation of brain and its covering layers, develops. The person becomes very drowsy and sleepy during the day, leading to the condition known as sleeping sickness. If untreated, the disease progresses and can be fatal. Sleeping sickness, sore at the bite, then sorry, sore at the site of the bite. This is also called as African trypanosomiasis or sleeping sickness. Fatal if left untreated, affect the central nervous system. The fatality rate is significantly high. The parasite is transmitted by the tsetse fly. Treatment is by means of antiparasitic drug. If it is not possible to completely eliminate the parasite from the body, and there is no vaccine against the disease. Now we will see the laboratory diagnosis of trypanosomiasis. First one, demonstration of trypanosomes, which is direct detection. The parasite, trypomastigote form, can be seen under the microscope in peripheral blood, especially during fever when parasites are numerous. Bone marrow, in severe or advanced cases. Lymph nodes aspirate, helpful when lymph nodes are enlarged. Cerebrospinal fluid, in later stages when the CNS central nervous system is affected. Second one is serological diagnosis, which is antibody tests. Detects antibodies produced by the body against Trypanosoma brucei. Common tests use ELISA, which is enzyme linked immunosorbent assay, then indirect fluorescent antibody test IFAT, and card agglutination test for trypanosomiasis, which is CAT, a rapid screening test. In short, diagnosis is made by finding the parasite in blood, bone marrow, lymph, or CSF, and by antibody tests like ELISA or CAT to confirm the infection. Please like, share, and subscribe to my YouTube channel, and don't forget to press the bell icon for more updates. Thank you.